We will treat the lip and upper marionette area with a cannula. To do this, we will have a single introduction point, which is made with the introducer needle that is in the TSK 25 gauge 38mm cannula pack. This is a 23 gauge needle, so we make a hole just laterally in the extramucosal area to allow entry. The entry port is made with the needle perpendicular to the skin and then rotated to just loosen any fibrous tissues. You can leave the needle in to make sure you're not in any artery, and if there was, there would be a back spurt. Here the needle is taken out. And we use the 25 gauge cannula to insert through the hole. The tip is dome shaped, which allows ease of entry through the insertion point. And then with the proprietary coating on the cannula, it allows it to slide through the tissues into the plane that is required. A gentle rotation movement allows penetration into the area required. Here we're going in to the body of the lip, just laterally, to allow the product to be placed in the tissues. The product is injected. We know exactly where the product comes out because it is coming out at the tip of the cannula, and it can be controlled and visualized as the injection is performed. This enhances the lateral portion of the lip, and the cannula can slide out as the injection is performed. At the same time, the same insertion point can be used to inject in this upper part of the marionette fold. Here we are again proceeding with the cannula, redirecting it, and then gently allowing it to slide through the tissues into the plane. And there we are, exactly where we want the product to be. The tip demonstrates where the product should be, and then we can inject at the same time. The correction is performed. The cannula slides with its coating through the tissues. The shorter length, the 38mm length, allows good control, in my opinion, because it is slightly stiffer and it allows me to control where the cannula is at all times. It is, in my view, I think it allows you, starting off, to really understand how to use a cannula. But ultimately, it is your own decision to decide which length of cannula you use, but with experience one can graduate into longer cannulas to treat more areas of the face through the same insertion point and reach different areas. Again, we can replace a cannula and slide it through the tissue planes to where we want it to be. This is performed easily with the geometric shape of the tip, because the tip is dome shaped. It allows it to go through the tissues with relative ease compared to a flatter tip, and it causes less trauma as you rotate it, because it moves the vessels aside and will allow you to be generally safer and hopefully cause less bruising. Again, you can see the correction is performed. We'll just put a little bit more into the lower part just to enhance that a bit more. Helen, how are you feeling with that?
Great.
Great, how wonderful. Does it feel painful at all?
No.
What are you feeling when it's going through the tissues?
You feel like a little soft thing, but not pain, or you feel that you do something.
Lovely. the whole point of this is to use the cannula gently to guide it through the tissue so it glides in the tissues rather than forcing it very hard into the tissue plates. And you can see the correction is performed, the area is cleaned, and that's performed with the cannula.